This week's Ask Dr. Durie comes from a patient who is anxious to know, what does it mean, this recent FDA approval of the next generation sequencing test for measurement of minimal residual disease in myeloma? What does the approval of this test mean for patients? Well, this is obviously excellent news. It's wonderful to have an approved test available for MRD testing. This NGS next generation sequencing test is sensitive, it's reliable, and this is what has been affirmed by the FDA approval. So this is fantastic. However, it is important to put this into context in terms of how are we using MRD testing in clinical trials and in day-to-day clinical practice. In clinical trials, we are using both the NGS test and the NGF test, next generation flow, which are both equally sensitive at the 1 in a million level to assess if there is any minimal residual disease after treatments within a clinical trial. Within day-to-day practice, the NGS test is now available. However, I'd just like to emphasize that in day-to-day practice, the truth of the matter is that we still really do not have clear guidelines about what to do if this type of an MRD test is negative or positive. If the test is negative, are we secure to stop treatment? If the test is positive, are we secure that maybe some different treatment is required? And so ongoing clinical trials are really essential to continue to try to answer these questions so that clear guidance can be given both for local doctors and for individual patients. The other very, very important part is that we do need, in addition, approval from the FDA for the use of MRD negative, as a serious endpoint in clinical trials. If a treatment produces MRD negative, does this mean that that treatment is better than a treatment where MRD negative is not achieved? And this is something where the I-Squared team, which is a team put together out of the Black Swan Research Initiative project and is a team submitting data to the FDA right now. When this team puts this data together and submits it to the FDA, we will have an answer if they accept MRD negative as a reliable indicator that one treatment is better than another. And so, bottom line, the FDA approval of the NGS test is an excellent step forward. However, we still do have a ways to go before the routine use of MRD testing in day-to-day clinical practice.